GCS scale. It is a scale which is used to measure the level of consciousness and severity of head injury. It can be measured by observing three responses: eye opening, verbal response, and motor response. In eye opening, if the patient is opening and closing their eye spontaneously and normally, then the score is 4. If the patient open their eye on asking, then the score is 3. If the patient is opening their eye on pain stimulus, then the score is 2. And if they do not open their eye at all, then the score is 1. In verbal response, if the patient is well oriented and speaks properly, then the score is 5. If the patient is having confused conversation, then the score is 4. If the patient is having inappropriate conversation, then the score is 3. And if the patient is having incomprehensible sounds, then the score is 2. And if the patient is having no conversation at all, then the score is 1. Now, lastly, in motor response, if the patient obeys the command, then the score is 6. If the patient stays localized, then the score is 5. And if the patient withdraws our hand on trying to approach them or touch them, then the score is 4. If the patient is having abnormal flexion, then the score is 3. And if the patient is having abnormal extension response in the body, then the score is 2. And if the patient is having no motor response at all, then the score is 1. Here, the minimum GCS score is 3, which is in dead person, and the maximum GCS score is 15. A normal healthy person has a GCS score of 15. In a patient with head injury, it is important to see the GCS scale to see the severity of head injury, level of consciousness of the patient, and to make a treatment plan for the head injury patient.